Hello, this is Dr. Fumi Shimabukuro, Yui Clinic, Okinawa. Today, I will discuss breech presentation and answer these questions. Why are babies born upside down? What is breech presentation? What causes some babies to be upside down in mother's womb or uterus? Babies' heads are usually down. Approximately 85% have their heads down at 30 weeks. 90% or more are head down by around 34 weeks. About 95% of babies have head down position by 36 weeks, which is close to when labor begins. Babies do not suffer even with their heads down. It's normal to have their heads down. Babies are not breathing in the uterus. Babies get oxygen and nutrition from their mothers through the placenta connecting with the umbilical cord. The blood circulation system of the baby is different before birth. Sometimes babies do not move their heads down before birth. This is called breech presentation. Breech presentation can be buttocks first or feet first. Most breech babies present with their buttocks first. There are multiple reasons for breech presentation. One reason is uterine fibroids. A fibroid is a foreign growth, but it is not cancer. Fibroids will not kill someone, but they can be very uncomfortable. When uterine fibroids are present, the uterus becomes misshapen. The misshapen uterus will sometimes make it more comfortable for the baby to be in the breech presentation than in the head down position. Another reason for babies to be in the breech presentation is an abnormally shaped uterus. There are several kinds of abnormal uterus shapes. These are abnormal uterine shapes. The reason that women have abnormal uterine shapes is unknown. Generally, if abnormally shaped, the uterus will have a narrow uterine cavity, and this is normal uterus shape. Other reasons are first pregnancy, a low-lying position placenta, an extremely short umbilical cord, too little amniotic fluid. While there are some medical reasons that cause the baby to be in the breech presentation, the reason that many babies stay in breech presentation is unknown. Breech births are more dangerous to the life of the baby and mother. One medical complication that is more prone to happen during a breech birth is prolapse of umbilical cord. The situation happens when the umbilical cord comes out of the uterus before the baby's body. The reason it is more prone to happen during breech birth is there is more room in the mother's womb. When a baby is head down, the head takes up most of the space and typically prevents the cord from dropping through. When the umbilical cord comes out before the baby's body, the umbilical cord is compressed when the rest of the baby is moving through the birth canal. Another risk factor is that the baby's head can get stuck in the birth canal. During the time the baby's head is stuck, it can have reduced oxygen from the mother if the umbilical cord is damaged or blocked. These reasons make breech birth dangerous to the baby's life. There is a procedure to get the baby's head in the correct position for birth. The name is external cephalic version, ECV. This procedure is when a care provider moves the baby on the outside to a head-down position. The baby's head is moved to the correct position by taking the head down a head from outside the mother's abdomen and lowering it into the right position. With this procedure, uterine contractions usually occur. Uterine contractions can cause labor pains, leading to the water rupturing. Strain on the placenta and umbilical cord can cause the placenta can tear off and bleed in the uterus. The risk is not too high rate, but this procedure is not done often anymore due to high risks involved. I usually explain the risks of this procedure, and patients can choose whether they want to do this or not. Most of the time, when their baby is in the breech presentation, the patient chooses to have a cesarean section. It is not common, but sometimes breech babies are born without C-sections. The patient is informed of the risks of babies being born naturally in the breech presentation. It can be safe, and babies can be born safely with certain techniques. It is then the choice of the mother whether she wants a C-section or not. We try to avoid C-section when possible. Last year, 2 patients chose natural birth with breech presentation in Yui Clinic. Those births were first time for the mothers. Today, I explained about breech presentation. Thank you very much.